meantime, consistent challenges in wrestling the highly transmissible third wave of the COVID-19 virus continuing to consume critical resources at health facilities, ultimately leaving non-COVID patients at a loss. The unseen enemy, or as Doctors Hospital Dr. Charles Diggis sees COVID-19, the consistent drumbeat on healthcare and its resources. And he's basing that on the fact that the private hospital continues to see up to 90% of its admissions to its emergency services. And this particularly in the face of punishing cases this month alone.
North of 35, 40 patients a day coming to us with serious or severe COVID. A significant number of them require admission. And if your admission rate is going at a tick of 20 to 25 patients per day, our healthcare system is not designed to accommodate and to treat safely that kind of number.
Hospital officials long bringing the reality of the situation to the fore, stressing on continuous occasions that it has come down to who gets a ventilator and really who doesn't. Doctors, 17 ventilators are available on a daily basis. Of that number, 13 are being used to treat severe COVID cases. That, says Diggis, leaves 4, maybe 5 for non-COVID patients. Who gets those is left in the hands of a core group of people examining the ethics of each situation.
It is fair to say that on some days, the kinds of decisions that may face that team is that right now, we only have one ventilator, and we do know of 1 or 2 patients whose condition may deteriorate to the point where we need to make a decision about a ventilator. Let's just say that that decision is going to be made in the moment. It's going to be made based on some objective data as well as other considerations. And let's just say that, unfortunately, that decision is one that we come to a little too often.
And here's what's really important about a loved one being placed on a ventilator.
The fact that you have escalated to need a ventilator and to be placed on one means that your survival rate is already not favorable. It doesn't mean that you will go on a ventilator and automatically die, but it does mean that the longer that you are requiring to be on a ventilator as well, and there's some other things that we do to you while you're on the ventilator to give you the best opportunity for survival, but the longer you require to be ventilated, then the lower your chances of survival overall become.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.